diabetes different from all other chronic conditions is the fact that our blood glucose level affects every system in our bodies, which means that it can have an impact on anything from our daily energy levels to the way we manage our stress. Numerous studies have proved that getting blood glucose levels as close to normal as possible has numerous benefits. Let's take a look at some of these benefits. Short-term benefits would be maintaining optimal energy and mental vitality on a daily basis and looking to prevent hypoglycemia and hyperglycemia. Long-term benefits would be reducing the risk of developing medical complications to your heart, eyes, kidneys and nerves. The amount of glucose in your blood affects the efficacy of circulation in the large blood vessels. Optimal control of your glucose levels, together with optimal control of high blood pressure and cholesterol levels, is vital in helping to reduce your risk of developing macrovascular diseases. These are diseases of the large blood vessels that may progress to a heart attack or a stroke. The good news is that studies have proven that even a small amount of weight loss, up to 7 kilograms, can contribute to a significant reduction in blood pressure. Although hypertension can be successfully controlled by medication, you will gain additional benefits by making lifestyle changes that will enable you to reduce the amount of medication you need to take in order to achieve a near to normal blood pressure. Studies have shown that limiting your salt intake, eating more fruit and vegetables, consuming less saturated fat, decreasing alcohol consumption were all extremely beneficial for lowering blood pressure.
Research has shown that people with diabetes have a blood fat profile that is particularly atherogenic. This means that their LDL cholesterol is small, dense, and prone to oxidation, while their HDL cholesterol is often too low. Let's take a close look at lipid levels. The American Heart Association and the American Diabetes Association have issued recommendations for what they consider to be normal blood fat levels in people with diabetes. If you already have heart disease, diabetes, or a family history of heart disease, your total cholesterol reading should be less than 4.5 millimoles per litre. If you have a low risk of developing diabetes, your total cholesterol reading should be less than 5 millimoles per litre. An LDL cholesterol should be less than 2.5 millimoles per litre if you already have heart disease, diabetes, or a family history of heart disease, and less than 3 millimoles per litre if you have a low risk of developing diabetes. An HDL cholesterol should be greater than 1 millimole per litre in both categories, and triglyceride levels should be less than 1.7 millimoles per litre in both categories. An LDL cholesterol is also known as the bad type of cholesterol. It carries cholesterol from the liver to the other cells in the body, and too much in the blood clogs the arteries, and this contributes to atherosclerosis, heart disease, and stroke. The message is simple: the lower the value, the better. Another type of fat in the blood is called triglycerides. High levels found in people with diabetes and with heart disease are detrimental. Triglycerides may be raised due to excessive weight or obesity, smoking, physical inactivity, an excess alcohol consumption, or a high carbohydrate diet. But the news is not all bad when talking about cholesterol. An HDL cholesterol is known as the good type of cholesterol, or the helpful cholesterol. An HDL cholesterol carries cholesterol away from the arteries back to the liver to be excreted. An HDL cholesterol protects against heart attacks, and therefore a low HDL means a high risk for cardiovascular disease, and a higher value of HDL cholesterol is recommended. Participants in the long-running Diabetes Control and Complications Trial, otherwise known as the DCC trial, who successfully controlled their blood glucose level, managed to reduce their risk of developing heart disease by 41%. The trial was the first study to prove the importance of optimal blood glucose control. It involved 1,400 selected volunteers with type 1 diabetes, who were monitored over a period of 6.5 years. They strictly controlled their blood glucose levels by using multiple daily injections, resulting in an average HbA1c reading of 6%. Another study, the United Kingdom Prospective Diabetes Study, otherwise known as the UK-PDS study, was conducted among 3,800 newly diagnosed individuals with type 2 diabetes. They were divided into an intensive intervention group and a control group, and were observed over a period of 10 years. Over that time, the intervention group achieved an HbA1c level of less than 7%, which, coupled with lowered blood pressure, reduced by 25% their risk of developing complications of the small blood vessels of the eyes, kidneys, and the nerves, otherwise known as microvascular disease. They also reduced by 16% their risk of developing heart disease and other related conditions.
It is very important to develop an individual treatment plan to control your diabetes optimally. You need to master 4 key areas: exercise, nutrition, medication, and monitoring in order to manage your health, your diabetes optimally, and ultimately to prevent complications such as macrovascular complications.